On today's video, we will talk about adrenocortical agents. So let's begin. Indications for use of adrenal agents. These are widely used to suppress the immune system and also for short-term uses. It also relieves inflammation during acute stages of illness, but that does not mean it can cure any inflammatory disorders such as hepatitis, asthma, allergy, but just to relieve the inflammation. The anatomy of adrenal glands, you can locate it the flattened bodies, which sit on top of each kidney. There are two kidneys on us, and you can locate them at the top of it. For the composition of the adrenal glands, adrenal medulla is the inner core, which is a part of sympathetic nervous system, while the adrenal cortex, it is the outer shell that produces hormones called corticoids. So the normal controls and action of adrenal gland. The hypothalamus releases corticotropin releasing hormone, which is also called CRH, which means if it's released, the corticotropin or the ACTH from the anterior pituitary is released. The ACTH stimulates the adrenal cortex to produce and release corticosteroids. As you have seen to the to the figure, you will see how the hypothalamus contacts or send message to the adrenal gland, which is gives a sign that the corticotropin will release a hormone, and the ACTH stimulates adrenal cortex to produce and release corticosteroids. Increasing levels of corticosteroids can inhibit the release of CRH and ACTH. The exogenous corticosteroids act to inhibit CRH and ACTH release. The adrenal cortex is no longer stimulated and atrophies. Sudden stopping of steroids results in a crisis of adrenal hypofunction, which can lead to hypothalamic pituitary axis controls that could not stimulate, but the adrenal gland can stimulate again. There are three types of corticosteroids. These are androgens, glucocorticoids, mineralocorticoids. For androgens, uh, these are the male and female sex hormones, while the glucocorticoids, it stimulate an increase in glucose levels of energy, while on the other half, which is the mineralocorticoids, it affects electrolytes levels and also homeostasis. What are the actions of adrenocortical hormones? The actions of adrenocortical hormones are increased in blood volume, which the aldosterone's effect cause the release of glucose for energy, slow rate of protein production, which reserves energy, block activities of the inflammatory and immune systems, which reserves a great deal of energy. There are different type of causes why there's adrenal insufficiency. Example for that is a patient does not produce enough ACTH. Adrenal glands are not able to respond ACTH. Adrenal gland is damaged secondary to surgical removal of the gland or prolonged use of corticosteroid hormones. We're gonna talk about adrenal crisis. We'll talk about signs and also the treatment. For the signs, you can assess physiological exhaustion to the patient. You can see there's a hypotension, fluid shift, shock, and also even death. While on treatment, you can have massive infusion of replacement of steroids. You can also monitor constantly and the life support procedures. Corticoids actions, it can enter the target cell and bind to cytoplasmic receptors. It can also initiate many complex reactions responsible for anti-inflammatory and immunosuppressive effects. Hydrocor- cortisone, and prednisone have some mineralocorticoid activity. There are indications also of the glucocorticoids, which in the short-term treatment of many inflammatory disorders, it can also relieve discomfort and also give the body a chance to heal from the effects of inflammation. Pharmacokinetics, it can well absorb from many sites and metabolized by natural systems, mostly within the liver. It can also excreted in the urine. For the contraindications, there are known allergies and acute infection and also lactation. Caution, diabetes, and also acute peptic ulcer. The adverse effect. The adverse effects are related to route of administration. Systemic use is associated with endocrine disorders. The drug-to-drug interaction, it can increase in drug when given with erythromycin, ketoconazole, or trolianodomycin. Decrease in drug is when given with salicylates and barbiturates, phenytoin, and also rifampin. The mineralocorticoids actions are can hold sodium, and with it, the water in the body causes the excretion of potassium by acting in the renal tubule. The indications: replacement therapy in primary and secondary adrenal insufficiency, while the pharmacokinetics of it is absorbed slowly and distribute throughout the body. The hepatic metabolism. The contraindications: there are known allergies, hypertension, CHF, and also cardiac disease. For the caution, the pregnant woman might be cautious on taking those hormones in the presence, and also there is a high sodium intake. The adverse reactions are increased fluid volumes and also allergic reactions, while to drug interactions can decrease the effectiveness with salicylates, barbiturates, hydantoins, and also rifampin, and also the anticholinesterases. Just as I told earlier, the use of adrenocortical agents across the lifespan. The children using these corticosteroids for the same indications as in adults. This dose for children is determined by the severity of the condition being treated and response to the drug, not on weight or age formula. The children need to be monitored closely for any effects on growth and development, and those adjustments should be made or drug discontinued if growth is severely. If the growth is severely retarded, can also do a topical use of corticosteroids should be limited in children because their body surface area is comparatively large. The amount of the drug absorbed in the relation to weight, which is weight is greater than in an adult. Apply sparingly and do not use in the presence of open lesions, open wound, lacerations, or anything. Also, do not occlude treated areas with dressings or diapers. Mostly of the children has diapers ranges from 0 months to 7 years old, which may increase the risk of systemic absorption. Children need to be supervised when using nasal sprays or respiratory inhalations to ensure that proper technique is being used. For adults, adults should be reminded of the importance of taking these drugs in the morning to approximate the urinal rhythm. They should also be cautioned about the importance of tapering the drug rather than stopping abruptly. Several over-the-counter topical preparations contain corticosteroids. The adult should be cautioned to avoid combining these preparations with prescription topical corticosteroids. They also should be cautioned to apply any of these sparingly and to avoid applying them to open lesions and excoriated areas, such just like in the haba
Use
nung
of
sinabi.
adrenocortical agents for the adults should be reminded of the importance of taking these drugs in the morning to approximate the urinary rhythm. They should also be cautioned about the importance of tapering the drug rather than stopping abruptly. Several over-the-counter topical preparations contain corticosteroids, and adults should be cautioned to avoid combining these preparations with prescription topical corticosteroids. They also should be cautioned to apply any of these sparingly and to avoid applying them to open lesions or there are excoriated areas. Same to the children, you must avoid those lesions or lacerations. With long-term therapy, the importance of avoiding exposures to infection or crowded areas, people with colds of the or flu, activities associated with injury should be stressed. If an injury or infection should occur, the patient should be encouraged to seek medical care, and monitoring blood glucose also levels should be done regularly. These drugs should not be used during pregnancy because they cross the placenta and could cause adverse effects on the fetus. And if the benefit to the mother clearly outweighs the potential risk to the fetus, they should be used with caution. Nursing mother should find another method of feeding the baby if corticosteroids are needed because of the potential for serious adverse effects on the baby. So, adrenocortical agents on older adults, they are more likely to experience the adverse effects associated with these drugs, and those uh, and the dose should be reduced and the patient monitored very closely. Older adults are more likely to have hepatic and renal impairment, which could lead to accumulation of drug and resulting to toxic effects. They are also more likely to have also medical conditions that could be imbalanced by changes in fluid and electrolytes, metabolism changes, and other drug effects. Such conditions should include diabetes, heart failure, osteoporosis, coronary artery disease, and also immune suppression. Carefully monitor the drug dose, and also the response to the drug should be done on a regular basis. So, what is prototype glucocorticoids? The prototype glucocorticoids is a replacement therapy in adrenal cortical insufficiency. This is a short-term management of various inflammatory and allergic disorders, hypercalcemia associated with cancer, hematological disorders, ulcerative colitis, acute exacerbations of multiple sclerosis, palliation in some leukemias, trichinosis with systemic involvement. The action of it is it can enter the target cells and bind to intracellular corticosteroid receptors, initiating many complex reactions are responsible for its anti-inflammatory and immunosuppressive effects. The pharmacokinetics, the route of it is a PO. The onset varies, a peak 1 to 2 hours, and the duration is 1 to 1.5 day. The prototype mineralocorticoids indications. The prototype summary first is the fludrocortisone. The indication is partial replacement therapy in cortical insufficiency, uh, treatment of salt-losing adrenogenital syndrome, off-label use, treatment of hypotension. The actions is increases in sodium reabsorption in renal tubules and increases potassium and hydrogen excretion leading to water and sodium retention. Pharmacokinetics is also PO for the route. The onset is gradual, peak is 1 to 7 hours. Durations is 18 to 36 hours. The adverse effect frontal and occipital headaches, arthralgia, weakness, increased blood volume, edema, hypertension, heart failure, rash, and also anaphylaxis. On the nursing consideration for glucocorticoids and mineralocorticoids, you must always assess the history and physical examination. And for the nursing, also the nursing diagnosis, implementation, and evaluation. In short, do the ADPI. That's all. And thank you for listening. I hope you enjoy. I hope you learned something. I hope